Good morning, everyone, and thank you for joining today's webinar. My name is Chris Sambera, and I'm a product specialist here at Pulse Centers. Today, we're presenting PEMF can support digestive health. My background includes 20 years experience as a nutrition and naturopathic consultant, and now 2.5 years with Pulse Centers as a product specialist. Before we get started today, I'd like to go over a little housekeeping. If you have any questions during the webinar, please type them into the question box. It's actually located in the GoToWebinar control panel, and I'll be sure to bring them up at the end of the webinar. Now, without much further ado, presenting this information today, I have 6 objectives that we're going to discuss. And they are, number 1, how PEMF effectively supports the digestive tract. Number 2, symptoms of intestinal distress. Number 3, common digestive disorders. Number 4, positions that provide energy into the digestive tract. Number 5, a pulsing plan for digestive support. And number 6, other factors that actually are required for supporting the digestive system. PEMF can help to support digestive health. So how does it do this? Well, PEMF helps digestive system just as it does virtually every other system and organ in the body. It provides voltage to undercharged cells, which they can use in order to rejuvenate, repair, and whatever the body deems necessary for it to be able to do to get to its highest level of function. Now, benefits to this area can obviously, or I should say, when we get dysfunction in these areas, you can sometimes have some very unpleasant symptoms. But when we start getting some energy into those areas, all of a sudden, some of those symptoms have an opportunity now to start disappearing. And obviously, what we want to see is enhanced digestive function. Now, of course, remember, Dr. Tennant, in his book, Healing is Voltage, shared with us that imbalances in the body are always due, at least in part, to electrical weakness in the cells. The cells are electrical. And that's why PEMF, which provides that energy back into the cells, can have such a dramatic positive effect on those areas of the body. So be sure that we want to be able to get some energy back into the cells. Next, and there are symptoms of intestinal distress, and there are many that can occur when the digestive system is simply under duress and isn't functioning optimally. And you'll get these, and they can include bloating, gas, cramping, bloody stools, foul-smelling gas, constipation, diarrhea, difficulty swallowing, and malabsorption. Now, these will typically start occurring when the issue first starts and then can escalate in intensity as the imbalance gets more severe. So what we want to be able to do is to arrest those issues when they first get started. Now, some of those symptoms, like the bloody stools, the difficulty swallowing, and the malabsorption, they might occur a little bit later in the game, but certainly bloating, gas, cramping, and some constipation, diarrhea, you'll get those at earlier stages when an imbalance just begins to start happening. That's your signal to start addressing it. You don't want to wait until the issue gets bigger. Next, common digestive disorders. So this is what happens if you don't address those symptoms in the earlier stages. The issues grow and they compound and they become bigger and bigger until at some point they can become a disorder such as GERD, gallstones, celiac disease, Crohn's disease, ulcerative colitis, hemorrhoids, difficulty, diverticulitis, I should say, leaky gut, and some of the other more advanced cases. So it's very important that we not allow these issues to get to these stages. And that's where you, as a practitioner, have an opportunity to start working, hopefully with some of your patients or clients as they come in to see you, that they're coming in at the earlier stage and not this stage. Obviously, if they're coming in at this stage, you're going to have to proceed a little bit more cautiously, but we still want to be able to provide voltage and energy into these areas of the body as well. So just know that we want to work ideally on the earlier stage before it gets later. Next, positions that provide energy into the digestive tract. So what I show here are 3 different positions that we can use to help to put energy into those areas. And the first one is the stacked paddles on the abdomen. And what I like to do when I'm doing this position, first of all, the blue paddles, or if you've got some of the old paddles that are black on both sides, and are smooth, they'll go and face directly into the body. And then you'll, of course, put them and set them right on to the abdomen area, the lower abdomen. What I like to do when I'm pulsing this area is to move the paddles a little bit to the right and start there. And then maybe wait, if I'm doing, say, 16 minutes, say at least 5 minutes or so, I work on the right side. Then after that period of time, then I move them more toward the middle of my abdomen and get the center part. And then after the next 5 minutes, then I move to the left. And that way I can get the entire, a little bit more comprehensive aspect of it. Certainly the paddles are big enough for most people that they're going to be at some point touching much of the area, but you won't get the sides as well. So I like to make sure that I'm using it in that way. The second position with the square pad on the abdomen, the blue side of the square pad is focused directly into the body in this particular case. Now, this is with the square pad on by itself. And you're going to get a lot more real estate. And one of our product specialists, Marsha, is demonstrating that position. As you can see, it's pretty much just going all the way, almost all the way up to her neck, and then it's coming down, even down into her pelvic area. So it's going to get a lot more real estate with that position, but also realize it's going to pulse a lot more area. And if you're dealing with someone who's very toxic, or if you're dealing with someone who maybe is a child or is very, very petite, that may seem like, almost overkill to that person in the beginning. So just know that it's a position that we, are going to be a little bit more cautious with some of the more toxic people that you may have, people who've eaten poorly, a lot of processed food in their diet, people who have come in with more severe advanced disorders. Probably going to, take our time with that position. And then the third position is a combination with the bed and the square pad at the same time. And so when the bed is on, and the same would be true with the chair, but the bed or the chair is on and you're using the square pad on the abdomen as well, now the black side will face the person with the dimples, and the blue side will face away. Just what happens when we have a combination with that particular accessory, with a large accessory, I should say. All three of those positions, as I said earlier, these are going to be areas that will detoxify more. So some of your more toxic people, depending upon who come in, you may choose to do nothing but the chair or the bed with them for the first 2, 3, maybe even the first 4 or 5 sessions. If you decide that, wait a minute, we want to move a little bit more cautiously with these people, just know that that may be what you'll do. Pulsing plan for digestive support. So I wanted to lay out what these accessories, how they might be utilized and what a 1-hour session with someone might look. And so, of course, we always start every single session off with a whole body accessory, whether that be the total body bed or whether that be the chair pad. And then, of course, you're laying or sitting on it. And then that time is 16 minutes. We want to try and make sure that we're getting all this done within a 1-hour time frame. And the PPS, it just depends. It can be on the lower side. We won't start at 5 pulses per second, but we might start at 2.5 or 3, or we might try a 7.8, or even going up to a 9.9, depending upon what we're trying to do with that person. The more toxic people, we may use the 7.8 to 9.9. Some of the people who aren't necessarily as toxic, we may start them off at 2.5 or 3. Square pad, the next position could be the square pad on the core for 16 minutes as well. With that, you're going to have pretty broad use of them, but you'll start again 2.5 or 3, and then you'll probably try a 7.8. The more toxic they are, a lot of times we'll use that 7.8 with them as well. Stack paddles, again, 16 minutes, 2.5 to 7.8. Again, 2.5 to 3 or 7.8. See what feels best to that person, as well as whether or not they're real toxic. Or we might use the total body bed with a square pad on the core. So this is a combination. We do that sometimes when we're working with individuals who may have a lot of areas that we want to try to get some energy into, and we can combine the whole body, in essence, with the square pad at the same time. Now, this time frame here, I've got 3 positions right in the middle: the square pad, the stack paddles, or the total body bed with the square pad. We would only do 2 of those 3 positions. We aren't going to have time to do all 3, but I wanted to give you kind of one that you don't necessarily do all the time, but one if you wanted to change things up a little bit and have a little bit of diversity in your session. And then, of course, every single session, we're going to end with low intensity pulsing, whole body. We always do this at the end of a session so that we help to minimize or hopefully eliminate any type of detoxification issue that they may have. However, as I said before, I might choose to do nothing but the whole body bed or the chair pad with someone. Well, maybe I'll do 20 minutes of whole body, and then maybe the entire other roughly 36 to 38 minutes, I might do nothing but low intensity pulsing on the bed or the chair. Why? Well, because if I determine that that person has been, has had a very severe illness, maybe gone through cancer and had chemotherapy treatments, we're going to want to start much more gradually with those people. So just know we're going to go probably lower and slower with those individuals, and then the pulse rate on those tends to be 1 to 2 pulses per second. Next, other factors that can actually help to support the digestive tract. Now, PEMF is a great tool for being able to support energy into the gastrointestinal tract. There are other factors that are very important as well, and if you aren't really encouraging your people to do this, you're missing an opportunity to help them improve and get better results than you would otherwise. So be sure to really try to always address this with people. I know you can't control what they eat and whether they're active or not, but we always want to bring it up to people because we never know when we might change their mind. So number one, healthy eating. So you want to encourage them to eat whole, nutritionally rich foods as opposed to a lot of sugar and processed foods. Big improvement. Number two, nutritional and herbal support. Now, of course, we've got our Pulse Fuel, which we recommend before every session, and we recommend that you sell it to your patients and clients as well, that they can take on a daily, regular basis. You may determine that they need additional support as well for their particular situation. So that gives you an opportunity to discuss that there. Exercise, we say a minimum 30 minutes, 4 to 6 days a week, whether that be walking, jogging, hiking, something with their moving, breathing, taking oxygen in. Next, optimal hydration. So that could be, what we usually encourage people to make sure that they're doing is that they're drinking at least half their body weight in ounces of water per day, and that's minimal. So if they weigh 100 pounds, we want to encourage them to drink at least 50 ounces of water per day. And if they're drinking coffee and they're, in a job maybe where they're outside a lot, they're sweating a lot, they may need more in order to, or if they've been through some type of treatment with a medication, maybe they need to use a little bit more water. And then the last thing, of course, is sufficient sleep. And we encourage people to make sure that they're getting 7 to 8 hours per day minimal. The body's got to repair, and sleep is one of those required factors. And all those things, by the way, help the body to hold on to that charge longer. And if you can hold on to the charge longer from a PEMF session, in between sessions, the body can still be using that energy for repair and rejuvenation. Now, next, make sure that if you don't have experience working with some of these nutritional programs with your patients, that's not your background, make a partnership with a nutrition and naturopathic practitioner. They can help to create a customized program, and then you can refer people back and forth. It's a true win-win when you find something like that, because it's going to help your clients, patients, to get better results and get them faster, as well as feeling better as they go through this process, all of which is very important to that process. Okay, now it looks like we have time to answer a couple questions from our audience, and you can use the question feature in the GoToMeeting control panel. And it looks like we have a couple questions coming in, and they are, okay, Chris, I'm looking forward to this webinar. A few questions. We already have planned to cover okay, so somebody already put these in. When working with clients that having an active flare of Crohn's or colitis, what is the recommended approach? Okay, this is a good question. It says that PEMF actually helps to stop the bleeding. I haven't seen that. I wouldn't recommend say that. There is a fairly low research tying Crohn's and colitis to bacterial infection. Okay, I mean, this is probably going beyond my PEMF can use to support an antibacterial regimen. Okay, So what they're wanting to know is how do you proceed when you've got someone who's got Crohn's or colitis, which is a much more advanced digestive disorder? That's a great question, by the way. So those are the people that you probably will start initially doing just whole body and in the beginning, and you're probably going to keep the MFS fairly low. So you're going to want them maybe where they can just barely feel the pulsing happening as they're doing a session. If you've got the Pro, that may be, I don't know, 35 or so on the MFS. You want to keep the PPS probably low. Some people have found that some of the autoimmune cases or people who are a lot sicker, they like using the 7.8. So I would try a 2.5, or excuse me, a 1 to 2 pulses per second. The MFS, I would probably keep it somewhere between 15 and 30 for those people. And I would probably from there, just do whole body and make sure you do a great deal, at least 20 minutes of the low intensity pulsing at the end. You can maybe do 50-50. That would probably be the first approach that I would do. So that was Dan. Okay, here we have. Any feeling on using binders like activated charcoal to help clear out toxins? That's a good question. Do you use Dr. Stokes? That's probably a little bit more than my expertise, but what I would say when dealing with that, because each case is going to be different. Activated charcoal, if used, tends to bind, yes, but it also tends to constipate. So, and from my own personal use, when I've only used activated charcoal, when I had cases of diarrhea, because it's going to also tend to bind with nutrients or whatnot. But yes, you could certainly use it for short periods of time, and it could be helpful in some situations. How do you indicate revise the chart for the X? Please indicate revise the chart for the, I'm not sure. Oh, okay, for the X system. Okay, very good. Okay, so you're just gonna, it's very easy. It's on the Pulse X. All you're gonna do is turn it to where they can barely feel it, and you're gonna have to stay there. So in those cases, they're probably gonna be, because when you first turn the system on, it's gonna be roughly any of our Spark Gap devices, the X or the X1, it's basically gonna be at a 9.9. And then you'll probably just turn it up a little bit more, and it'll be in that, 9, 8.5, 8, 7.8, when they just start to feel it. So you're going to already be at the high pulse rate, and that's where you're going to have to stay with those people in the beginning. These are very sensitive people. If it's a more advanced case, if it's more moderate, you might be able to put a little bit more energy in. But if they've got a lot of issues going on, I would want to start all these cases with real low energy. If it's something that hasn't been there in a long time, and it's something that comes up every now and then, but they've had it in the past, but it's not active now, I still wouldn't probably go more than, say, half the strength of the system with it. And so I think that's probably the best way that I would keep it. Okay. All right. And it looks, oh, here we go. We have one more question. Okay. The person was asking, when I say they're more toxic, well, it just tends to mean that they're probably those individuals who have a lot of symptoms, and the digestive tract, because it's an area of elimination, tends to detoxify when it's working optimally. When it's not working optimally, what many times will happen is that things will start to get stored in the body. And as things start to get stored in the body, the dysfunction becomes more and more prominent. And so you'll get more symptoms, and then you may eventually get that disorder, that disease. So just know that in those, in those particular cases, that that's why I was saying if they're real toxic, you're going to want to start lower and slower. Basically, if they have a lot of symptoms or if they've got a disorder, is what I would say. Okay, and it looks like we've finished the questions. Those were great questions, by the way. So thank you very much for those. Thank you everyone for attending and participating in the webinar today, and thank you for your questions. They were outstanding. If you have any further questions, you can call our office at 770-334-2226 and ask to speak to a product specialist. Additionally, please follow us on social media. Next month, we're going to have our webinar with our CEO, Greg Johnson. kind of wrapping things up for this past year, but also telling us a little bit about what's going to be happening in 2020. And that's going to be Friday, January 10th at 2 p.m. So can't wait for that one as well. Be sure to follow us on Facebook, Twitter, YouTube, and Instagram. And until we hear from you, you have a great weekend. And if I don't hear from you before, have a great holiday season, everyone. Take care.